In recent years, a wave of alarming headlines has circulated across social media, news sites, and online forums claiming that modern life is slowly damaging men's reproductive health. Among the most dramatic claims is the idea that the penis itself is shrinking. For many men who encounter these stories, the reaction is immediate concern. It raises questions about whether environmental toxins, lifestyle habits, or invisible health problems could be quietly affecting the body in ways they never considered before. While sensational headlines often oversimplify complex medical topics, the underlying concern about protecting sexual health is completely valid. The penis, like any other organ in the body, depends on healthy blood flow, balanced hormones, and well-functioning tissues. When those systems are disrupted, changes can occur over time. However, the reality is far less mysterious than many viral claims suggest. Most of the factors that influence penile health are the same factors that influence overall cardiovascular and metabolic health. In everyday clinical practice, patients rarely arrive asking whether their penis is shrinking. Instead, they come in with related concerns. Some report weaker erections than they used to have. Others notice changes in firmness or difficulty maintaining arousal. Occasionally, someone worries that their penis looks shorter than it did years earlier. These observations often lead people down a rabbit hole of online explanations that focus heavily on environmental chemicals or dramatic biological theories. But in the majority of cases, the real explanations are rooted in well-understood medical principles. One of the most important elements of penile health is blood circulation. Erections occur when blood flows into specialized tissue within the penis, causing it to expand and become firm. This process depends on healthy blood vessels and the production of a signaling molecule called nitric oxide. Nitric oxide allows blood vessels to relax so that more blood can enter the erectile tissue. When blood vessel health declines, erections become weaker, less reliable, and sometimes shorter in duration. This is why physicians often view erectile difficulties as an early warning sign of cardiovascular problems. The arteries supplying the penis are smaller than those supplying the heart, which means they may show signs of damage earlier. In some cases, a man who develops erectile problems later learns he also has high blood pressure, high cholesterol, or other conditions affecting blood flow. Lifestyle habits play a powerful role in maintaining the health of these blood vessels. Among the most harmful habits is smoking. Cigarette smoke contains a mixture of chemicals that damage the inner lining of blood vessels, making them less flexible and more prone to narrowing. Over time, this damage reduces the ability of blood to circulate efficiently throughout the body. When the vessels supplying the penis are affected, erections may become weaker or more difficult to maintain. Smoking also creates a biological environment known as oxidative stress. This occurs when unstable molecules called free radicals accumulate and begin damaging cells. Within penile tissue, oxidative stress can injure the smooth muscle cells that allow the penis to expand during an erection. As these healthy cells are lost, they may be replaced by fibrous tissue, which is less elastic and does not stretch as easily. The result can be a gradual decline in erectile quality. Another factor that influences how the penis appears is body weight. Many men are surprised to learn that the visible portion of the penis represents only part of its full anatomical structure. The shaft extends inward beneath the skin and attaches deep within the pelvis. When excess fat accumulates in the lower abdomen, particularly in the area above the pubic bone, it can partially cover the base of the penis. This does not mean the penis itself has changed in size, but it may appear shorter because more of it is hidden beneath the surrounding tissue. This phenomenon is sometimes called a buried penis, appearance in individuals with significant abdominal fat. Even moderate weight gain can make the penis look smaller than it did previously. In some cases, losing weight restores the visible length simply by reducing the fat pad that was covering part of the shaft. Another common misconception involves the phrase "who's it" or "lose it." This idea is often presented in exaggerated ways, suggesting that a lack of sexual activity will permanently reduce penile size. The reality is more nuanced. Erections serve an important biological purpose beyond sexual activity. When the penis becomes erect, oxygen-rich blood flows into the tissue, nourishing the cells and maintaining their elasticity. The body naturally provides this oxygenation through spontaneous erections during sleep. Most healthy men experience several erections each night during the phase of sleep known as rapid eye movement or REM sleep. These nighttime erections help maintain the health of erectile tissue, even if a person is not sexually active. Problems arise when a person stops experiencing these natural erections. Conditions such as cardiovascular disease, diabetes, and severe erectile dysfunction can reduce or eliminate nighttime erections. Without regular oxygenation, the tissues inside the penis may gradually lose elasticity, which can lead to subtle shortening over time. This is one reason doctors encourage men experiencing erectile problems to seek evaluation rather than ignoring the issue. Understanding these biological processes reveals an important theme. The health of the penis reflects the health of the entire body. Factors that damage blood vessels, disrupt hormones, or impair circulation can affect sexual function long before other symptoms appear. Conversely, habits that support overall health, such as maintaining a balanced diet, staying physically active, and managing chronic conditions, also protect sexual function. In the following chapter, we will explore the medical conditions and lifestyle factors that most strongly influence penile health, including how metabolic diseases, hormonal changes, and tissue damage can alter the structure and function of the penis over time. When people hear the phrase penile shrinkage, it often sounds dramatic or even frightening. In medical practice, however, what patients are usually noticing is not that the penis itself is disappearing, but that underlying health changes are affecting how the tissue functions and appears. To understand why this can happen, it helps to look more closely at how penile tissue stays healthy throughout a man's life. The penis is made up of specialized erectile tissue designed to expand when filled with blood. This tissue contains smooth muscle fibers, blood vessels, and elastic structures that allow it to stretch during arousal. For this system to work properly, the tissue must remain flexible and well supplied with oxygenated blood. When that supply is interrupted over time, the structure of the tissue can slowly change. One of the conditions that can significantly affect penile tissue is diabetes. Chronic high blood sugar affects nearly every organ system in the body, and the reproductive system is no exception. Elevated glucose levels cause inflammation and chemical reactions that damage blood vessels and nerves. In the penis, this damage can impair the release of nitric oxide, the molecule responsible for relaxing blood vessels during an erection. When nitric oxide production decreases, blood flow into the erectile tissue becomes less efficient. At the same time, nerve damage from long-standing diabetes can interfere with the signals that trigger arousal. The combination of reduced blood flow and nerve dysfunction often leads to erectile difficulties. Over long periods, the tissue itself may undergo structural changes. Healthy, smooth muscle cells can gradually be replaced by fibrous scar-like tissue that does not stretch as well, which may result in subtle changes in penile length or firmness. Another important aspect of this process is the role of oxygen in maintaining tissue health. Every time the penis becomes erect, oxygen-rich blood fills the erectile chambers and nourishes the surrounding cells. These repeated cycles of expansion and oxygenation help preserve elasticity. When erections stop occurring regularly, whether due to severe erectile dysfunction, vascular disease, or nerve damage, the tissue no longer receives this periodic oxygen supply. Without it, the smooth muscle cells may deteriorate over time. This phenomenon is one reason physicians often emphasize early treatment for erectile dysfunction. Restoring erections, whether through lifestyle changes, medications, or other therapies, helps maintain healthy blood circulation within the penis. In many cases, treating the underlying vascular problem improves both erectile quality and long-term tissue health. Another condition that can influence penile shape and length is Peyronie's disease. This disorder involves the formation of scar tissue known as plaques within the fibrous sheath that surrounds the erectile chambers. When plaque forms in one area of the penis, it can prevent that portion of tissue from expanding normally during an erection. As a result, the penis may bend or curve toward the side where the plaque is located. For some men, this curvature is mild and causes little difficulty. For others, it can lead to pain during erections or interfere with sexual activity. Over time, the presence of scar tissue can also contribute to a slight shortening of the penis because the fibrotic area restricts expansion. The exact cause of Peyronie's disease is not always clear, but researchers believe it often begins with repeated micro-injuries to the penile tissue. These injuries may occur during vigorous sexual activity or other forms of mechanical stress. In most people, small injuries heal normally. In others, the healing process becomes abnormal, leading to excessive scar formation. Certain health conditions appear to increase the risk of developing Peyronie's disease. Men with diabetes, cardiovascular disease, or metabolic disorders seem to experience it more frequently. These conditions can interfere with normal wound healing and increase inflammation, which may contribute to abnormal scar formation. Another intriguing area of research involves how early life health may influence adult development. Some observational studies suggest that severe obesity during childhood might affect hormonal and developmental processes that occur before puberty. During this stage of life, the body undergoes critical growth and reproductive development. Hormonal imbalances or metabolic disturbances during that window may influence how genital structures develop. Although the evidence in this area is still emerging and requires further study, it highlights how overall health during childhood and adolescence can have lasting effects on the body. Healthy nutrition, balanced hormone levels, and normal metabolic function all contribute to proper development during puberty. Despite these biological mechanisms, it is important to emphasize that many fears surrounding penile shrinkage are based on misunderstandings. For example, when men gain weight and notice less visible length, the change often results from fat accumulation in the lower abdomen rather than an actual reduction in penile tissue. Similarly, temporary erectile difficulties caused by stress or fatigue do not mean that permanent structural changes are occurring. The penis is a resilient organ, and many of the processes that threaten its function are reversible or manageable when addressed early. Quitting smoking, controlling blood sugar, improving cardiovascular health, and treating erectile dysfunction promptly can all support long-term tissue health. Another key point is that sexual health rarely exists in isolation from overall health. The same factors that protect the heart and blood vessels also protect erectile function. Regular exercise improves circulation, balanced nutrition reduces inflammation, and proper medical care helps control chronic conditions that might otherwise damage delicate tissues. In the next chapter, we will explore practical strategies men can use to maintain penile health throughout their lives, including lifestyle habits, medical awareness, and early intervention when changes occur. Understanding these steps empowers individuals to protect not only their sexual function, but their overall well-being. Once people understand how penile health is connected to blood flow, hormones, and tissue elasticity, an important realization begins to emerge. Protecting sexual function is not about chasing miracle products or reacting to alarming headlines. Instead, it is largely about maintaining the same habits that protect the rest of the body. When those systems are healthy, the penis tends to function well. When those systems begin to deteriorate, sexual changes are often among the earliest signs that something needs attention. One of the most powerful protective actions a person can take is to avoid smoking or to quit if they already smoke. Tobacco use affects nearly every blood vessel in the body. Over time, it damages the delicate inner lining of arteries and reduces the ability of those vessels to expand properly. Because erections depend on rapid increases in blood flow, even subtle vascular damage can interfere with the process. Many patients are surprised to learn that erectile difficulties sometimes appear years before symptoms of heart disease, making them an early warning signal rather than an isolated issue. The encouraging aspect of this connection is that the body has an impressive ability to recover when harmful exposures are removed. Men who stop smoking often experience improvements in circulation and erectile function over time. The earlier this change happens, the greater the likelihood that the blood vessels and erectile tissue can return to healthier function. Weight management is another factor that has a noticeable impact on how the penis appears and performs. As discussed earlier, excess fat accumulation in the lower abdomen can partially conceal the base of the penis. Losing weight may reveal more of the visible shaft, which many men interpret as a change in size even though the underlying anatomy has not changed. Beyond appearance, maintaining a healthy weight also improves blood pressure, cholesterol levels, and hormone balance, all of which support erectile health. Equally important is paying attention to chronic conditions such as diabetes. Diabetes is particularly significant because it affects both blood vessels and nerves simultaneously. High blood sugar over long periods can impair circulation, reduce nitric oxide production, and damage the nerves responsible for sensation and erectile signaling. However, careful management of blood sugar dramatically reduces these risks. Regular monitoring, healthy nutrition, physical activity, and appropriate medical treatment help protect tissues throughout the body, including those involved in sexual function. Another practical strategy involves recognizing and addressing erectile changes early. Many men hesitate to speak with their doctors about sexual concerns because they feel embarrassed or assume the issue is simply part of aging. Yet physicians view these symptoms as valuable health information. A change in erection quality can sometimes reveal underlying cardiovascular or metabolic conditions before other symptoms appear. By discussing the issue openly, patients allow healthcare providers to evaluate possible causes and recommend treatments that may restore function while also protecting overall health. Preventing injury is another aspect of penile care that often goes unmentioned. While sexual activity is generally safe and beneficial for most people, Trauma to the penis can occur during vigorous or awkward movements. Sudden bending or impact during intercourse may lead to micro injuries in the tissue. Repeated injuries can contribute to abnormal scar formation, which in some cases develops into conditions such as Peyronie's disease. Using adequate lubrication, communicating with partners, and maintaining awareness of body positioning during sexual activity can reduce the risk of accidental injury. Equally valuable is learning to recognize early warning signs of changes within the penis. Persistent pain during erections, a new curve or bend that was not present before, or noticeable shortening should prompt evaluation by a healthcare professional. Early intervention may allow treatments that slow progression or preserve tissue elasticity before scarring becomes more advanced. Beyond specific medical conditions and injuries, the broader message is that sexual health reflects overall wellness. Habits that improve cardiovascular fitness, such as regular exercise, balanced nutrition, adequate sleep, and stress management also support healthy erectile function. Exercise, for example, strengthens the heart and blood vessels, improves circulation, and helps regulate hormone levels. These same benefits translate directly into better sexual performance and endurance. Nutrition plays a role as well. Diets rich in vegetables, fruits, whole grains, healthy fats, and lean proteins support vascular health and reduce inflammation. Conversely, diets high in processed foods, excess sugar, and unhealthy fats contribute to metabolic disorders that can damage blood vessels and impair erectile function over time. Stress management is another frequently overlooked factor. Chronic stress keeps the body in a constant state of alertness, increasing levels of stress hormones such as cortisol. Elevated cortisol can interfere with testosterone production and affect sexual desire and performance. Developing routines that allow the nervous system to relax, whether through exercise, meditation, hobbies, or time spent with supportive relationships, helps restore balance to the hormonal and neurological systems that influence sexual health. Perhaps one of the most reassuring messages for patients is that the body is capable of recovery when given the right conditions. Blood vessels can regain flexibility, metabolic health can improve, and erectile function often responds positively when underlying issues are addressed. While certain structural changes may require medical treatment, many early concerns improve significantly through lifestyle adjustments and proper medical guidance. Ultimately, protecting penile health is less about reacting to fear and more about understanding the body. The same steps that support heart health, metabolic balance, and emotional well-being also protect sexual function. When men view sexual health as part of their overall health rather than a separate or embarrassing topic, they are far more likely to seek information, adopt healthy habits, and address concerns early. In the end, the most powerful strategy is awareness. Paying attention to changes in the body, maintaining healthy daily habits, and communicating openly with healthcare providers creates a foundation for long-term sexual health. Instead of worrying about sensational headlines or viral myths, individuals can focus on the practical actions that truly matter, taking care of the body as a whole. Because when the body is healthy, sexual function tends to follow.